The interim report of the Auditor General on the audit of utilization of COVID-19 resources as at 31st July 2020 has revealed massive irregularities in the transparency, accountability, and management of the resources. One such example is on the irregular transfer of funds by the Ministry of Health. Now, according to Section 32, Chapter 5 of the Public Finance Management Act No. 1 of 2018, a transfer of public money shall not be made between accounts at the same bank or different banks without written approval of the Secretary to Treasury. But contrary to the provision of the Act and the circular, the Ministry of Health transferred 60,884,345 kwacha, which it received from the Treasury Single Account (TSA) to a bank account held at First Capital Bank without approval from the Secretary to Treasury. It further reveals that there was no explanation as to why the ministry had moved the funds from the Treasury Single Account at Bank of Zambia into a bank account that had been opened for donor funds at a commercial bank. However, in response to this, the Ministry of Health says after seeking authority from Secretary to Treasury, there were indications that approval was going to be granted, but instead the request was later rejected. Another example is that of irregular cash withdrawals, again by the Ministry of Health. Now, according to the Treasury and Finance Management Circular No. 1 of 2020, controlling officers were guided that no cash shall be withdrawn for payment of subsistence allowances, fuel refunds, and any other allowances. However, contrary to this, between 20th March 2020 and 30th May 2020, the Ministry of Health made cash withdrawals in amounts totaling 3,361,196 kwacha, which were used to pay various allowances and fuel, among others. On this issue, the ministry in question did not give a response. Virginia Chilongo, Movie TV News, Lusaka.